So, hi everyone. Today we're going to see a basic topic of humerus. Um, Good morning everyone. Today I'm going to present the topic on the clinical ortho of fracture of humerus. So, introduction. Humerus is a long bone of the upper arm extending from the shoulder joint to the elbow joint. A fracture of humerus refers to the break in a continuity of his bone and is commonly seen in following traumas like humerus fracture are clinically important because they can significantly affect upper limb function and may associated with neurovascular injuries, especially as radial nerve palsy. So, coming to the causes, the causes of the humerus fracture can be broadly classified into four types of categories: direct trauma, indirect trauma, fuse injuries, and pathological causes. So, direct trauma, road traffic accident, fall directly on the arm, assaults or industrial injuries are direct trauma, and indirect trauma, force injury, falls on an outstretched hand, twisting injuries. What is the pathological causes? Osteoporosis, especially in elderly individuals, bone tumors or metastasis, metabolic bone disease, etc. So, birth injuries seen in neonatals during difficulty to or assist the deliveries, etc. So, coming to the clinical features. The clinical features are symptoms include severe pain in the arm or shoulders while the injury has been occurred, swelling and bruising, inability to move the affected limb, visible deformity or shortening of the arm or a limb, tingling sensation or numbness due to nerve involvement injuries. What are the signs? Uh, Local tenderness at the fracture site, abnormal mobility, crepitus sounds, visible deformity, radial nerve in case of radial nerve palsy, which may present a wrist drop. So, classifications. Humerus fracture can be classified based on fractures pattern into transverse, oblique, spiral, and communicated. They may also classify it based on anatomical location as proximal humerus fracture, shaft humerus fracture, and distal humerus fracture. Each type has different management and rehabilitation considerations. So, investigations. The primary investigations are X-ray and CT scan. X-ray including shoulder joint and elbow joint, since the pathological changes may be occurred in elbow joints also. The additional investigation includes CT scan for the complex and intra-articular fractures, the MRI when soft tissue or ligament injury are suspected. These investigations help to confirming diagnosis and planning the treatment for the humerus fracture. Then coming to the management. So, management depends on types of fracture, age, displacement or disorientation of the fracture associated with complications, and the conservative management are arm slings, U shape, U slab, and hanging cast, and functional bracing. And the surgical managements are open reduction, internal fixation, means ORIF, planning for a plating placement and intra medullary nailing. The physiotherapy plays a vital role in a post immobilization to restore functions, range of motions, muscle strength, and functional independence. The complications are common complications of the humerus fracture include malunion, non-union, radial nerve injury, shoulder or elbow stiffness, chronic pain, and functional irritations. So, early diagnosis of proper management and rehabilitation can reduce these complications while the fracture occurs. So, coming to the conclusions. To conclude that fracture of the humerus is a common orthopedic condition that requires diagnosis appropriate management and effective rehabilitation in a multidisciplinary approach ensure that optimal recovery and restoration of the upper limb functions. Thank you.